project that my students and I did a few years ago. I teach. Okay, good afternoon. My name is Ron Barry. I'm a Protective Services Instructor at the Causeway Career Technical Center. For my presentation, my video clip on diverse learners, I revisited a project that my students and I did a few years ago. I teach protective services, which is firefighting, EMT, and law enforcement. I was fortunate enough, because he was a rather remarkable young man, to have in my class a few years ago a student who was totally blind. This young man was blind from birth and couldn't see anything. His visual acuity amounted to, he could see light when he passed the window, but nothing else. So obviously you can imagine there were some challenges training him to do some of the skills. But one skill that I thought that I could adapt for those that are visually impaired is CPR. CPR skills, the way the American Heart Association guidelines are now, don't really require the ability to see. You rely on your other senses. You rely on your ability to feel and to hear. And when we adapted the techniques, the students performed remarkably well. So today, I have two of my students who are not visually impaired, because we don't have any visually impaired students currently at the Career Technical Center. But they're going to play the part of visually impaired students, and we need to say that we mean no disrespect whatsoever to anyone who is visually impaired. This is for demonstration purposes only. So, one of the core concepts of CPR is to do what we call a tap and shout assessment. Okay? So the first step in the process would be to determine whether the patient's responsive. And you can do that by speaking to the patient, gently shaking and tapping them, and listening and feeling for a response. So the way we adapted that for visually impaired students was to have them place their hands on the shoulders of the patient, okay? Tap the shoulders and say, hey, are you okay? Hey, okay? And they could feel, they keep their hands on the shoulders and feel for any movement to know if the patient was responsive or not. The next step in the process, after calling for help, would be to check a carotid pulse. So to find the landmarks, we taught the students to put their index finger and middle finger on the Adam's apple and move down toward themselves approximately 1 inch, which puts them in the area needed to assess a carotid pulse. Carotid pulse is a very strong pulse because it's a central pulse. The carotid arteries branch off the aorta, which comes right directly off the top of the heart, and it's a very, very strong pulse. If a person doesn't have a pulse there, they probably don't have one at all. So just like the guidelines state, they would assess for that pulse, which, if there is one there, is easy to feel for 5 to 10 seconds. And if there was no pulse, they would start chest compressions. Now, to find the proper landmarks for chest compressions, we taught the students to place their hands in the center of the chest, okay, and feel for the flat spot, which is the sternum bone, under the heel of their hand. Once they did that, they were to place their other hand over top of the first, interlock their fingers, lean over the patient for a little bit more directional force, and deliver a series of 30 chest compressions. Okay, are we ready? And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Now the next step in the process, if you're doing the heart saver, which is the professional level CPR, which we certify them in, would be to deliver 2 rescue breaths. Each student was given a pocket mask and barrier device, okay, which they're going to show you very easily fit into a case. They could very easily be taken out and assembled for use without the ability to see. Okay? They were also taught, and if you look closely at the mask, it has a teardrop shape to it. They were taught to find the point of the mask with their fingers, which goes directly over the patient's nose. That would teach them to seat the mask properly to get a good seal. So after they oriented the mask in the right direction, they would put it over the patient's mouth and nose, okay? And using both hands, they would tilt the head back to open the airway and deliver 2 good rescue breaths. Now, ordinarily, a sighted person performing CPR would watch for the chest to rise and fall. Okay, to adapt for that, I taught the students to feel for the presence or absence of resistance. In other words, if there's no resistance when they deliver the breath, that tells them that the air is going in. Okay, so go ahead, guys, give 2 breaths. Watch and see if the chest rises on the mannequins. It did on both of them. Excellent. Now, you may think to yourself, well, if they can't see, how would they know if the patient started breathing on their own? Well, again, we were able to adapt that. So instead of watching for chest rise and fall, we taught them to place their ear near the patient's mouth and nose. Okay, go ahead, guys. And to also place one hand on the patient's chest. This way they could hear or feel for exhaled breath on their ear or the side of their face, and their hand would allow them to feel for chest rise and fall. Okay? After a few practice rounds, the students they exceeded my expectations. So, in a nutshell, that's how we accomplished it. We also had the written exam that goes along with that. We had that whole entire exam put into Braille format. Okay, so they were able to take the test in Braille, and each one of them passed it with flying colors. So we certified 12 visually impaired students ranging from legal blindness, astigmatism, nearsightedness, farsightedness, all the way to total blindness in American Heart Association Heart Saver CPR. And my students were a big help in that, and we're very proud.